I'm Bronwyn Cooper at Dr. Foot Solutions here in Drummoyne, and we're the Australian distributors of Barefoot Science. Barefoot Science, as you know, is not a bracing splinting orthotic. It's rather a soft orthotic in two lengths, which is a arch engaging device, as you can see here. In the static, not in the static category, it's in a dynamic category, much like the difference between kinesio tape and rigid sports tape, with a central dome. So it's an arch engager. The dome, in fact, has a lot of commonality with Birkenstock. The only thing is, of course, Birkenstock has been done in hard materials, whereas the Barefoot Science has a dome where you introduce a resistance plug, and as the foot strengthens and the foot intrinsics switch on, you increase the resistance plugs, a bit like an in-shoe gym workout for the foot intrinsics, if you like. But of course, as you also know, the 200,000 nerves in the foot, in fact, are being stimulated big time with an unstable, soft but comfortable device like this. And so really it falls more into the category of, as I said, an arch engaging, not arch supporting device. So by that I simply mean that the arch structure of the foot is being forced to bear its load instead of the heel and ball copying it, as happens sadly with traditional support orthotics and in many support shoes. The other component about it is it's a senso-motoric based principle, not dissimilar to certain other devices now coming out of pedorthics in Germany in particular, where it's really aimed at sending different signals via the sensory nerves up to the brain and restoring correct movement patterns via natural movement of the body with muscle switching on and firing correctly and so forth. So it's really quite exciting to have a muscle activation device like this, but one that can also stimulate balance, and it stimulates balance big time immediately. The studies overseas have shown a reduction in postural sway of up to 50%, and I frequently retest patients once I put them into these in their shoes. However, in my specialised foot clinic, I also use footwear that does a similar thing. And so there's a combination of footgear that we have here that can help do these sorts of things for our patients. So ages that Barefoot Science can be worn, all ages. No age is too young or too small. There's just a limitation on sizes. Although extra small is available overseas, and if people have a big paediatric practice, if they'd please indicate that, we can certainly arrange to have more of these come through in our next shipment into Australia. So with the advent of these sorts of technology and moving away from the type of orthotic devices, the rigid splinting devices, otherwise referred to as functional orthoses, subtalar neutral, but really they're motion control. If you're trying to keep the foot in one position and function around that position, it's really motion control. Whereas now, based partly on the research out of Calgary, University of Calgary Human Movement Lab, Professor Ben O'Nig, who I heard speak on this in 2009, preferred movement pattern. So if you think of a Nike Free, if you think of a Skechers Go Walk or Go Run, and many other copies along these lines, but of course it really harks back to how our Dunlop volleys were based and still are from years ago. You just have, you don't have hard segments that block movement. You're really allowing the neural loop of the body not to be interfered with in the way that happens sadly if there is too much overly processed hard rubbers, plastic features in the soles of shoes, including the very durable treads. Durable treads are very good for shoe wear, but they're not good for wear of the feet. And as I say to patients all the time, I'd rather you wear the soles of your shoes out than wear your feet out, especially in this era where there are still not foot transplants. So foot types. Now, if someone has an anatomically flat foot, such as this one here, where it literally is almost parallel to the floor on the underside of the arch, they're clearly going to notice a dome of the Barefoot Science at a much earlier stage than a high arched configuration like this one here. Now this is the outside of the foot, and they don't all present as dramatically as this, as you well know, but you can see that there's a much bigger gap there, and initially that patient may not particularly feel the pressure anywhere near as much. Certainly if one foot is pronated and one isn't, the patient will invariably feel it on the pronated foot first. Now, this is your fairly typical average arch, and indeed, I would guess 80% of the people coming into my practice who are orthoticised and who still have masses of problems, frequently newish orthotics that have just never addressed their symptoms very much at all, in the first week or two maybe, and then that's about it. They often have feet that are like that, and you really wonder why the clinician was trying to support that arch when there's such other viable alternatives available. In everyday practice, barefoot science really can be used clinically across two broad categories, I guess I'd say. What we traditionally call musculoskeletal, which is all of your weight-bearing joint, muscle issues, soft tissue, all the way from the big toe through to the neck. And it's also around you people with locomotion problems in particular, and certainly if they've got balance issues, if they've got motor deficits, etc. So stroke patients, any of these people will often have impaired balance or poorly coordinated movement, and they invariably feel more sure-footed immediately on the day. And if they're in the wrong shoes, and you have the luxury, as I have, of having a shoe with no heel height called a zero drop shoe, brands we have here are Vivo, Barefoot, Ultra and Topo, for example, but we also have a number that only have 4 mils of heel height in them, such as a Skechers Go Walk or Go Run. The patient will have the effect accentuated. So in cases of motor deficits, that's really going to show up immediately. Equally, however, if a patient wants to put barefoot science into a high heel shoe because of the flexibility through the main part of the insole, what we podiatrists typically call the shell of the insole, it can go in a higher heel. It clearly doesn't work as well. But try telling that to someone who's suffering with tired, aching feet and legs, sore feet, back, etc., and they're wearing a highish heel, and they're standing in their job or at a conference or some such thing demonstrating, and what invariably happens is they will tell you immediately that they feel relief because of this instant senso-motoric change. So musculoskeletally, the absolute knockouts are anything in the forefoot area, but also the midfoot, particularly midfoot arthritis, any heel pain whatsoever. Because you're getting the heel and ball back level and the arch is bearing weight, you're actually taking weight off the ball of the foot. Don't discount them for even acute ankle sprains, as well as chronic issues with ankles, knees, shin splints, medial tibial stress syndrome and the like. Runners will tell you that their foot strike, not instantly, but they tell within half a block, they'll come back and they'll say, that landing is so different, it feels softer. Their foot strike has changed thanks to the stimulation of the proprioception. Back problems, hip problems, I think I mentioned. Look, in the study, shoulder shows up simply because if you're getting the person more erect and straighter, as you can see, their shoulders are going to be in a much better alignment than if they're slumped and slouched, as it were. And really, I find the reason this works so well is because our bodies were never designed to continually function in the urban built environment. By that I mean hard flat floors, footpaths, etc., and also shod. And if any of you have not read any of the seminal work around this by Dr. William Rossi, then I can thoroughly recommend you to our esteemed American podiatry colleague who died in his 90s, who wrote some great pieces about the myth of supporting school shoes, and in particular his mention of the 1948 Trade Commission inquiry in the US into the claims for overly protective kids' school shoes. And, you know, most people are not even aware of this if they don't dig back into history a little bit and come across this information. There are links to this on my website, so any of the clinicians that are using barefoot science in their clinics, can I actually commend you to click on all the different areas in our website, which at the moment are a little bit messy. You'll even see under videos, if you look at the one on patients, a patient who's really painful gait is changed immediately because his pain at the time is totally addressed, not permanently fixed, but just totally eliminated. You can see him changing very differently now. He's not wearing a barefoot science in a shoe. He's actually wearing the barefoot science principle in a ready-to-wear form of footgear called a fit flop, where there's the instability rubber in the centre section changes muscle firing, but it's also rocking him through, a bit like the curved sole of an MBT or a Hoka. So no matter how many patient problems I see and how profound, barefoot science is a really important part of this. I've recently treated patients very successfully who've been suffering with post-herpetic neuralgia, complications. One woman had that for over 8 years, complex regional pain syndromes, and this becomes a really important part of the treatment for those people. However, I also have the luxury of a class 4 medical laser now that I've had for 12 months, and we're really able to produce some outstanding results. But if you're in a clinic and you don't have that sort of technology, that's fine. You can at least be doing a lot to restore function with barefoot science, but also don't discount the influence of footwear. Really, the barefoot science mantra is stimulate, restore and strengthen. So stimulating balance, strengthening feet and restoring movement patterns. Now, I notice some clinicians tend to favour prescribing and dispensing full-length barefoot science, but don't discount that if you have 3/4 length in your practice, by eliminating the full-length cushioning piece under the ball of the foot, you can have the patient try this immediately in their footwear. So R.M. Williams riding boots, ladies ballet flats, court shoes, snug-fitting loafers and things of this nature. So if you really needed to have a few pairs on hand to always size someone, I would thoroughly recommend that you do that with a 3/4, because you can always order the others in if you don't have them in stock. Particularly if you've got a patient who's got a high volume forefoot where the foot is very broad, whether they might have toe deformities or malalignment, whether it's bunions or whether it's hammer toes, clawed toes and the like. And often these people present with neuroma-type symptoms from shoe pressure. And many of them, immediately, the first thing they notice if they're coming out of a traditional arch support bracing splinting orthotic will often, because of the reduced bulk of the barefoot science, say immediately, oh my goodness, there's more room in my shoes. And time again, I've seen people who've been treated for neuroma where simply removing bulk, taking weight back through the arch and offloading the ball of the foot has settled their symptoms significantly. I thought I would have to put some into rocker shoes. Didn't happen. They didn't even need to go down that path. Because one of the advantages of preformed orthotic device is the patient can get to try it on in your clinic and walk up and down in the hallway. If you run a busy practice, you can easily pop it into their shoe after you've just checked the size against their foot, if need be. Have them walk up and down the hallway, even if you have to go next door to start with the next patient. And that way you get instant feedback, as do they. And for that very reason, 95% of all my patients coming in about their clinical problems choose to take barefoot science, even corns and calluses. They come back. I've got fantastic photos in my photo gallery of some really nasty plantar corns and calluses with the right treatment, good general podiatry treatment, with this type of device, with appropriate offloading footwear in the rocker type family to offload the ball of the foot. The results have been absolutely outstanding. And already one woman who was having, a hairdresser who was having 3 weekly treatments, has been able to move to 6 weekly treatments in just 6 months, and her foot pain has diminished hugely. Her sore hip is no longer sore. So in your practices, if health fund claiming is something that's certainly very, very easy for podiatry. I'm not sure that the item numbers for physiotherapists and chiropractors, but you can customise the device if you wish, and orthotic category benefits are paid, as you know, by many health funds, and patients, of course, usually have an annual limit for this. So usually we find that in my practice, the majority of patients have chosen to take out private health cover in order to get benefits back to help them to solve their problems, help them to keep fit and healthy where possible, etc. And I've got people in my practice now that just come back in annually, have a checkup appointment, and will actually get repeat barefoot sites because naturally the rubber is fatiguing, as happens with all rubbers, and they love the fact that they can function pain-free simply because they're walking around on the hard urban built environment with a lovely little massage type effect dome. It's almost like a small slice of tennis ball, if you like, under the centre of the arch, just to change their neural firing and their weight-bearing surfaces. So I've tried to just give you a little bit of an insight into some of the ways that I use barefoot science, because in most busy practices, if you're seeing 80 patients a week, for some clinicians is not a high number, especially if there are multiple clinicians there, and unless you're doing at least 20 pair a week, I would say that you're not thinking through the myriad of conditions that you could be using this for. Just a quick word on plantar fasciitis and hallux limitus, the two most common foot problems that I see in everyday podiatry practice, and I'm sure it's not much different in physio and chiro practices around foot symptoms. You know, when I started in practice some 40 years ago, we hardly saw any of those two particular conditions, and certainly if you read the works of a number of leading preferred movement coaches, otherwise known as barefoot running coaches, such as Lee Saxby, read the work on Vivo Barefoot's website. And Vivo Barefoot, by the way, is the company set up by two of the ex-Clark's Shoes people who have seen the light, as it were, and are out looking at giving people shoes that are actually good for their feet. If you look at the Canadian physio Blaise Dubois, which is the runningclinic.ca, you'll actually see there's some really good mentions and work around footwear and the influence of overly protective shoes. And I certainly in my clinic have observed over time that at the worst excesses of these, which was probably about 5 years ago, I mean motion control shoes with really hard, heavy rubbers and plastics as part of the features. Look, here's one, and you wouldn't see this old Brooks Beast anymore, but you still see lighter versions with some of these features. The wearer of this particular shoe had in fact spent $6,000, I think it was, over a 10-year period. She was a teacher who had, and that was before I had medical laser, but settled her plantar fasciitis totally. So I call plantar fasciitis now a dis-ease of modern society, and it's more about the overly protective shoes than anything else. Equally with the hallux limitus, it appears that a lot of people have been overstriding, and as a result they've overloaded their first MP joint, of course. I hope these insights have been helpful. We look forward to some feedback, and even lay people may benefit from this video. So don't forget, there is plenty of further information on our website at Dr. Foot Solutions. Thank you.